you get to work with a really diverse team, so you work alongside the GPs, nurses, healthcare assistants and reception staff.
I've worked with all sorts of people. My tutor, I'm very fortunate, is an advanced clinical practitioner. So he's a pharmacist who also runs his own clinics.
I completed the induction programme first, which was just a local in the GP practice, and it was so worthwhile because it meant I'm in to sit at reception. I met all the reception staff, the prescription clerks, the doctors, the nursing staff, and then any community staff that would be coming in.
With the nurses here, the practice nurses, the advanced nurse practitioners, as well as the district nurses I guess occasionally deal with as well.
I met the managers, the practice managers, the community midwives, the children's lead nurse, and then I went outside into the community. So I was in touch with many people, as well as working very closely with 2 pharmacists based at the GP practice. So I had 2 tutors, one at Leeds and one in the GP practice. Something that really was helpful is that just before I started the split placement, which was just after Christmas, we had a meeting where the 3 of us could meet. It was really good because I was able to speak to both of them, explain what I would like to achieve out of the GP and also what I'd already sort of achieved at the hospital site.
The support that I got from the HEE team was really good.
They were great in answering any queries or questions I had prior to starting my training. And what I found really beneficial was the conference that they held, which enabled you to network and meet other pre-regs who were in a similar situation to you.
They also set up a group chat which the other pre-registration pharmacists were also in, who also did a GP split.
During the split placement, I then had meetings with HEE, so someone would come down on site. It was really helpful, meant to realise then if we were on track, if we weren't, what could we do. And I also then received several emails throughout my time there asking how I was getting on.
I also received a training pack from HEE, which was a national training pack, and that included things that I could do to meet certain competencies.
I also felt that at any point I could return to the hospital if I needed to speak to my tutor there. I had my tutor on site, and then had the health education England team as well.